In this section, now we will talk about the cardiotocograph. We will talk about the features of cardiotocograph, also what's the fetal cardiograph and computerized cardiotocograph. Cardiotocograph is the continuous tracing of fetal heart rate used to assess fetal well-being, together with an assessment of uterine activity. So it's the continuous tracing of the fetal heart rate along with the along with the uterine contraction, and it is usually performed routinely in patients who are at risk and who have high-risk pregnancies to find out the effect of the uterine activity on the fetal heart rate. So sensors are placed on the abdomen to find out the uterine contractions and also recording of the fetal heart activity. So if you see, these are the sensor for fetal heart and uterine contraction sensor. So two sensors are placed. One is for uterine contraction, other is for fetal heart. Important cardiotocograph features to define normality and identify abnormality and potential concern for fetal well-being. So this is very important to identify any abnormality, and it tells the whether the condition of the baby is good or not. Fetal cardiac behavior, we have three mechanisms that affect the fetal cardiac behavior. Vasomotor mechanism, this is the vasomotor mechanism is the mechanism that gives the dilation and contraction of the blood vessels. Then there is chemoreceptor mechanism, in which there is identification of these receptors are responsible for measuring or detecting the level of oxygen and carbon dioxide, pH level in the blood. So fetal cardiac behavior also depend on chemoreceptor mechanism. And the third type is baroreceptor mechanism, which detects the pressure in the blood vessels and if it's low pressure or if it's high pressure. So all these mechanisms affect the behavior of the fetal heart. Important cardiotocograph features: baseline fetal heart rate. Baseline fetal heart rate is 110 to 150 beats per minute. Tachycardia is increased in heart rate. Bradycardia is decreased in the heart rate. Any maternal or fetal infections can affect the baseline fetal heart rate. Any hypoxia, anemia, and drugs like adrenoceptor agonist can affect the baseline fetal heart rate. So baseline is 110 to 150. Below 110 is bradycardia, above 150 is tachycardia. Then baseline variability, variations in the baseline. Short-term variability increases with increased gestational age, and long-term fluctuation present, which are modified by fetal sleep states and activity. So variations can occur which are short-term, long-term. Short-terms are mainly with the increase in gestational age. Long-terms are by fetal conditions or activity. Then fetal heart rate accelerations. Accelerations are increasing. Increase in baseline fetal heart rate of 15 beats per minute, lasting for at least 15 seconds, non-hypoxic fetus. No hypoxia is present, no decreased supply of oxygen is present, but again, even with that, there is acceleration of 15 beats per minute for 15 seconds. That's the acceleration. Deceleration or decrease is reduction in heart rate again for 15 beats per minute for 15 seconds. And in this condition, hypoxia is present and there is umbilical cord compression. So if deceleration, if cardiotocograph is performed and baseline is increased or decreased, then it should be alarming, especially with deceleration. Heart rates are decreased by 15 beats per minute in 15 seconds. That's alarming. This is the picture of fetal cardiograph. You can see A is showing the normal rate, normal variability. A is acceleration. So this is the normal, and if the accelerations are present, these are the accelerations. If more than 15 per minute in 15 seconds is not good. So this is fetal tocograph showing accelerations. This is the computerized cardiotocograph. This is objective and more consistent than central cardiotocograph interpretation. In this, since human errors are present, so as compared to subjective cardiotocograph interpretation, computerized cardiotocograph interpretation is more objective as compared to standard. So in this, its interpretation is done by the use of computer. Normal range for computerized cardiotocograph parameters available. So normal ranges are available in different periods of gestation, and any variation in that parameters can give us the idea about the outcome of the delivery. Useful predictor of fetal well-being in small for gestational age babies. So that was all about the cardiotocograph. Thank you for watching sqadia.com.